The development of art therapy and its profound usefulness as a healing practice can be historically linked to Sigmund Freud, a founder of psychoanalysis. Even though Freud has been criticized for many of his assumptions and theories, especially about sexuality, he's contributed significantly to a field of knowledge that unleashed groundbreaking insight into human behavior during a very restrictive period in history. His lack of understanding of woman and his theory on castration anxiety, penis envy, hysteria, and many other assumptions have been highly debated. Many of Freud's contemporaries were women who built on or criticized his work, and this interest created a snowball effect of advancements in neurology and psychotherapy around the world. Two pioneers in the field of art therapy and whose work is linked to Freud are Lamberg and Kramer. Both used Freud's understanding of unconscious in their therapeutic art practice with patients. Even though Freud himself never used the image of an iceberg, it can be an extremely useful metaphor to help us understand the way he perceived and understood the relationship between our conscious and unconscious mind. A tip of iceberg above the water represents the conscious mind, while the bulk of mental content in the unconscious lies below the surface. What makes mental health issues so challenging in that the content that prohibit optimal functioning is literally out of sight, out of mind, and liable to intrude upon consciousness without warning, without awareness of the culpable truth or belief. This is still valid 80 years after Freud. Have you ever wondered why you sometimes attract the same types of toxic people who are run lately for everything? Complicating matter further, the unconscious plays by different rules to those we assume to be true in conscious life. For instance, in the unconscious, there is no time, which is why trauma can resurface as a relentless memory. In the presence of a trigger, the brain responds as though it is happening now, not 10 or 30 years ago. Since the unconscious mind is believed to be a driver of what we really think, feel, and do, this susceptibility means that gains made using talk-based methodologies in the here and now are often limited. Take the dominant psychotherapeutic framework, cognitive behavior therapy, CBT. The focus of CBT is on observable behavior and conscious cognition thought. Treatment focuses on the changing dysfunctional assumptions, expectation, and interpretation of events, as well as negative self-talking into positive, healthy thinking. In the iceberg context, it works only at the tip, with thoughts and behaviors can be consciously assessed. So, what is art therapy? Ullman concluded simply and clearly that art therapy needed to be through to both art and therapy. She defined therapy as procedures designed to assist favorable changes in personality or in living that will outlast the session itself. and she defined art as a means to discover both the self and the world, and to establish the relation between the two. She also called art the meeting ground of the inner and outer world. Her statements on their relationship were clear. The realm of art therapy should be so charted as to accommodate endeavor where neither the thumb art nor therapy is stretched so far as to have no real meaning. Despite Ullmann's early and inclusive definition of the newborn procession, there was a series of what might be characterized as rather impressive custard battles. The biggest source of tension was whether art or therapy would be designated the dominant parent. Those who felt that art therapy's primary contribution was in the healing power of the creative process were drawn to what came to be called art as therapy. Those who felt that art therapy's primary value was as a means of symbolic communication sometimes called it art psychotherapy. If you pursue the literature, you will notice that while most refer of the field as art therapy, sometimes call their work by another name such as expressive analysis, clinical art therapy, psychoaesthetics, or expressive therapy. The definition of art therapy by American Art Therapy Association. Art therapy is an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. This is definition of art therapy by British Association of Art Therapists. Art therapy is a form of psychotherapy that uses art media as its primary mode of expression and communication. Within this context, art is not used as diagnostic tool, but as a medium to address emotional issues, which may be confusing and distressing. Freud, Jung, and others have observed and written the imagery can be used to encourage a person's unconscious to rise into their consciousness. In psychoanalysis, the unconscious is described as the part of the mind which you are not aware of, but which affects behavior and emotions. Art can often bypass vulnerability and defense mechanisms inherent to verbal communication, making visible an image in one's inner world. By making the unconscious conscious, art therapy can enable fundamental shifts that in turn alter conscious thoughts, feelings, and behaviors for the better. Emotions like anger and grief can play havoc with our lives and can be detrimental to our well-being. Many of us are aware how emotions that overwhelm us can cause us to lose focus on what we are doing. We may be unable to think of others, but only for ourselves or on the emotion that is taking charge. Not being able to process highly charged emotion in ourselves can lead to long-term problems, even depression and anxiety. Frequently, traumatic experiences from early childhood are triggered for things we feel in our adult life. Even with the best of parenting and support, we can still suffer intensely from an early age, which in turn will create many different negative feelings around grief and loss. These stored emotions, experiences, or trauma stay in the body and in the unconscious, and if unreleased can make the person either overwhelmed with emotion, angry, or any number of residual feelings can occur. This is often why depressed clients don't know why they are depressed. Depression can have a history of buried emotions. A great deal have been written about the need for talking about one's emotion in order to heal. However, sometimes clients, especially depressed clients, aren't able to target why it is causing them this distress. It can be confusing, so they aren't able to discuss their deep feeling or problems as they are not even consciously aware of them. So art therapy works to uncover unconscious feeling, grief, and trauma, stuck feeling in the body and mind. Art therapy can give a release to their experience by allowing the emotion to surface, be acknowledged, and to integrated. Once the unconscious becomes conscious and the deep-seated feeling becomes unstuck, the client is much more capable of talking about their problems, feelings, and thoughts. So it is helpful to use combination of art therapy for the unconscious work together with a talking therapy like CBT for consciously understanding ourselves. The intellectual forebears of cognitive behavioral therapies are found in empirical positivist tradition of American academic psychology rather than in the European philosophy attitudes that influenced Freud and many other psychodynamic therapists. Cognitive behavioral therapy, developed from cognitive therapy by American psychologist Albert Ellis and psychiatrist Aaron Beck, had a similar goal to psychoanalysis. This approach can help clients overcome difficulties, changing their behavior, and move forward in their lives. Many of the CBT treatments have clearly demonstrated their effectiveness in reducing symptoms. However, they are best suited to clients who are in need of short-term therapy, for example, 15 to 20 weeks. CBT is best suited for clients whose problems stem from more immediately issues and where inoculate thinking can be changed or modified in order to affect behavior. McWilliam contended that some clients also prefer a more focused and directed treatment, complete with homework assignment. Psychoanalysis and psychodynamic therapies are more contemplative processes that can take many years. The goal is to uncover the underlying unconscious schemata. Unlike CBT, it involves an emphasis on childhood and past experiences, on exploration of unconscious, and on wishes, dreams, and fantasies. CBT is similar to psychoanalysis in that there is exploration of patterns in the client's actions, thought, feeling, experience, and relationship. However, psychodynamic therapies differ in that they focus more on expression of emotion and the role of emotion in the client's life. The client's effort to avoid certain topic is also examined, as the fear of change is often a strong unconscious